Now we are going to start the primary biliary cirrhosis. Primary biliary cirrhosis and primary sclerosing cholangitis is very important for our both part 1 and part 2. In case of primary biliary cirrhosis, there would be intrahepatic cholestasis, and because of having some fibrosis and destruction of the intrahepatic bile canaliculi. But in case of primary sclerosing cholangitis, this fibrosis and destruction should be intrahepatic and also extrahepatic. Primary biliary cirrhosis is an autoimmune disorder and it will be female predominant, especially in the age of 40 to 70. And the female is to male should be 9:1, just like SLE. As it is an autoimmune disorder, so it can be associated with other autoimmune disorder, especially the Sjogren syndrome. The ACLE association in here, that is the DR3 and DR8, and there will be gradual destruction in the intrahepatic bile duct. The most common presenting feature of this primary biliary cirrhosis should be the lethargy and then the pruritus. So lethargy and pruritus is a very important common presentation of primary biliary cirrhosis. Now we can see in the clinical picture, initially this patient may have no syndrome, that means asymptomatic, just raised ALP and GGT. Patient may have lethargy, that is a fatigue, and pruritus. If patient develops jaundice, it indicates very bad prognosis. So lethargy is the most common symptom, followed by pruritus. There may be cholestatic jaundice and importantly hyperlipidemia. And this patient will have raised cholesterol level and xanthelasma and xanthomata. There may be hyperpigmentation, especially the overt pressure points like the dermatitis herpetiformis. And as this disease may turn into chronic liver disease, so patient may have clubbing, hepatosplenomegaly and portal hypertension. And ultimately, this may progress to liver failure. So as I have told you that if this primary biliary cirrhosis patient develops jaundice, it indicates very bad prognosis and its mortality rate would be very high. You can see here that survival is less than 2 years and criteria for transplantation if the bilirubin level is more than 100 and intractable pruritus. So median survival rate will be 7 to 10 years, but reduced to less than 2 years if the patient develop jaundice. And 5-year survival post-transplant is 70 to 80%. So early detection and treatment is very important. You can see in the picture, this is the intrahepatic bile ducts, and in case of primary biliary cirrhosis, this intrahepatic bile duct will be fibrosed and destructed. Now, in case of investigation, before going to investigation, we will know about some association with this primary biliary cirrhosis. The most important association is the Sjogren syndrome. So, patient may have dry eye, dry mouth syndrome, and also other autoimmune disorder like the rheumatoid arthritis, systemic sclerosis, CREST syndrome, thyroid disease, membranous glomerulonephritis, and renal tubular acidosis. In case of diagnosis of this primary biliary cirrhosis, the first line treatment should be the serological test. Very important. The test is the anti-mitochondrial antibodies, that means AMA, in M2 subtype. So AMA test is very important for primary biliary cirrhosis to diagnose and confirm the diagnosis. And it has very highly sensitivity and also specificity, like the 98%. So very important. And you can do other tests like the smooth muscle antibodies and raised immunoglobulin M. We know that in case of primary biliary cirrhosis and also in case of primary sclerosing cholangitis, the immunoglobulin M should be raised. But in case of alcoholic cirrhosis, the immunoglobulin A should be raised. Now, the complications of this primary biliary cirrhosis, like the malabsorption of fat-soluble vitamins, that's why this patient may have osteomalacia due to vitamin D deficiency, and due to vitamin K deficiency, this patient may have coagulopathy. Patient may have Sika syndrome, that means association with Sjogren syndrome, dry eye, dry mouth, and this patient may have portal hypertension like ascites, varicose hemorrhage due to chronic liver disease. Patient may turn into hepatocellular carcinoma, very important, like about 20-fold increase the risk. Very important. In symptomatic patients, the median survival rate, right about approximately 5 years without the transplantation, and overall survival from the diagnosis is put between 7 to 17 years. So early detection and treatment should be sought. Okay, now the treatment of this primary biliary cirrhosis. In case of primary biliary cirrhosis, we can give some medical treatment and also ultimately the liver transplantation. But in case of primary sclerosing cholangitis, the only treatment should be the liver transplantation. Now, the medical treatment for it, like ursodeoxycholic acid, and it will improve the liver biochemistry and delays the disease progression. For the pruritus, we can give cholestyramine and other drugs like cholestyramine, rifampicin, and sertraline. As this patient may have the deficiency of fat soluble vitamin, for this reason we will give supplementation of these vitamins. And ultimately, the liver transplantation is the treatment of choice, especially if the bilirubin level is more than 100.